Breastfeeding, also known as nursing, is the feeding of babies and young children with milk from a woman's breast. It is the traditional way of providing young infants with nutrients they need for healthy growth and development.
Breastfeeding is the most traditional form of providing nutrients to young children, but the implication of breastfeeding has evolved over time. From wet nursing to the use of formula, the history of breastfeeding is extensive. A wet nurse was a woman who would breastfeed another woman's child. This form of nursing was popular from 950 BC to 1800 AD. Wet nursing introduced bottle feeding and the use of formula, but due to this new trend, wet nursing became quickly extinct after the 19th century.
Human milk has an abundance of nutrients that are vital for infant development. When breaking down all the ingredients in human milk, it is easy to see why it is crucial for proper infant development. Within human milk, we can see the molecules and cells that drive the metabolism and provide the raw materials for growth. For the past decade, there have been intense studies on immunological factors in human milk, and there have been new findings of immune regulatory proteins which could be prompting the development of the infant's own immune system. When looking at breastfeeding and its effects on children later in life, there is a direct correlation between nursing and obesity. Studies have shown that a child who is breastfed will have a less likely chance of becoming obese later in life by 20%.
From 950 BC to 1800 AD, when a mother could not breastfeed a child, a wet nurse would come in and breastfeed that child for them. But after the 19th century, when formula gained popularity, more and more women started turning to formula and bottle feeding their child.
The average amount of time an infant will breastfeed is 6 months. Health professionals recommend starting to nurse as soon as the child is born and proceed to breastfeed until the mother cannot breastfeed anymore. From an evolutionary standpoint, in order to increase the amount of time a mother is capable of breastfeeding, is based on if the mother is balanced in metabolical investment and in milk production with her potential investment in future offspring.
Studies have shown that women who breastfed ages 15 to 29 has decreased. Women within the ages 30 to 44 has increased. Overall, breastfeeding has increased.
Studies have shown that women who work outside of the home and women who stay at home initially breastfeed at the same rate. However, the breastfeeding continuance rate declines significantly in mothers who return to work soon after giving birth. Some women decide not to breastfeed at all, due to many factors such as having other children to take care of, wanting one's body back to self, and not wanting to feel tied down.